dear chair, dear audience, dear colleagues, in the next few minutes I'd like to show you the prediction and prognosis of preeclampsia, my PhD title. So about my first project in summary. So currently there is no available highly accurate biomarker for preeclampsia, resulting to less awareness and late intervention of this dreadful pregnancy condition. Since 70,000 maternal and 500,000 fetal deaths occur worldwide yearly due to preeclampsia, there is a great unmet need to find a useful biomarker. We found that microRNA 210 levels in mild preeclamptic patients are 3.3-fold higher, and in severe preeclamptic patients 7.2-fold higher compared to normal healthy pregnant population, suggesting a dose-dependent association. At this stage, there is no direct clinical implication. However, it holds a great future research implication, and after evaluating the specificity, sensitivity, and predictive values of microRNA 210, we will get a very useful biomarker in the future. About me, I'm David. I'm a first-year PhD student, third-year OBGYN resident, and together with our great team, we have a vision to reduce maternal and fetal morbidity and mortality, and our mission is to provide proper and early diagnosis and treatment for severe preeclampsia. In order to achieve that, we had two specific projects. Both of them are systematic reviews and meta-analyses, and both of them are concerning preeclampsia. So what is preeclampsia? It's a syndrome during pregnancy that affects almost 5% of all pregnancies worldwide, resulting to almost 500,000 fetal and 70,000 maternal deaths per year. In order to diagnose, we need a form of hypertension and some form of maternal or fetal end organ damage. Clinically, we can differentiate between mild and severe forms. Of course, severe has a higher hypertension value and more severe end organ damage, and of course, it has more serious complications. To this day, there is no available predictive or prognostic value for severity. Different follow-up, hospitalization, and pregnancy outcome can occur at the different clinical stages of preeclampsia. So our first project was concerning microRNA 210 levels as a biomarker for preeclampsia severity. So preeclampsia pathogenesis is still relatively unknown. We know that placental malfusion, hypoxia, and oxidative stress are involved, and this microRNA 210 variant is a small non-coding single-stranded RNA, which is hypoxia-induced, and it has the most evidence and potential among microRNAs. The levels can be measured via qualitative real-time PCR, and usually the values are presented as a ratio between the preeclamptic and control values. We know that it contributes to the pathogenesis of preeclampsia, and the elevated levels could be associated with the severity of preeclampsia, so we investigated that. We hypothesized that elevated plasma or serum microRNA 210 levels are associated with the severity of preeclampsia, and we used the PECO framework when we compared mild and severe preeclamptic patients with patients without preeclampsia, and the outcome was microRNA 210 levels. We conducted our search on the 21st of November 2014, resulted more than 1,000 articles, and in the end we got 7 eligible articles for the meta-analysis. Here you can see our main results. As I mentioned, the outcome is fold change, which means a ratio between preeclamptic and control values. If it's 1, that means that the values are same in the preeclamptic and control population. If it's higher than 1, then it's higher in the preeclamptic population. We observed these levels in 7 case control studies, and altogether we had 75 mild and 110 severe preeclamptic patients involved. The heterogeneity was quite high. I will give the reasons for that later on. We found that microRNA 210 levels in mild preeclamptic patients are 3.3-fold higher and 7.2-fold higher in severe preeclamptic patients, which are clinically and statistically both significant. This is an evaluation of 2-armed case control studies. We had 6 of them, and we found that the severe preeclamptic patient has, in average, 2-fold higher microRNA levels compared to mild preeclamptic patients. It's also a statistically significant result. Here in the basic characteristic table, we can find, I tried to highlight it, the main reasons for heterogeneity. The first one is the gestational week per sampling. It's very different, unfortunately, and also the normalization control tool during the microRNA assessment technique in the real-time PCR. These are also very different. That's why it was hard to get a homogeneous population, but still the microRNA assessment techniques were the same, only the normalization control was different. So we found that, our findings suggest a strong association between the elevated microRNA 210 levels and preeclampsia, and it has some form of dose-dependent association. Currently at this stage, we cannot give any clinical implication. However, it holds a great future implication for research. First, we will need to develop a standardized method for microRNA assessment in pregnant patients. And with this, hopefully later on, if there are more prospective studies in early pregnancy, we could get a predictive value of these microRNAs for preeclampsia and a prognostic marker. It could be a prognostic marker at the time of diagnosis for severity. Our strengths are rigorous and precise methodology, and we have an important future research implication. However, we had small sample sizes and only case control studies were available. With our progress, we are done with the manuscript, and we already submitted it to AJOG, and now we are submitting it to BJOG, British Journal of Obstetrics and Gynecology. We want the submission to be done this week. The second topic will be investigating diary consumption as a protective factor for preeclampsia in pregnant women. So as we know, maternal nutrition is a very important modifiable factor among pregnant patients, and it affects the maternal and fetal health, and many aspects of it is quite relatively unknown. Worldwide, dairy is an affordable and nutrition and calcium-rich food type, and is commonly consumed during pregnancy. That's why it's very important to know what it does, and its effects are not fully proven. Meta-analysis from last year showed that calcium supplementation could reduce the risk of preeclampsia by up to 47%. And this diary seems to have a risk reduction effect regarding preeclampsia in a calcium and non-calcium based effect too. And hopefully we will try to investigate this diary consumption as a protective factor for preeclampsia in pregnant women. Our clinical question is that is higher diary consumption during pregnancy associated with lower risk of preeclampsia? We will use a PEO framework, and the outcome will be the risk of preeclampsia. With this, we can give new dietary guidance for pregnant women, and we will have guidance for future research, what type of dairy products and in what quantity and what timing should we absorb and advise for pregnant patients. Our preliminary search in 5 databases resulted around 1,000 articles, and we have 3 very good key articles where they observe drinking glasses of milk during pregnancy, and in the end, the adjusted and calculated risk ratios, odds ratios were lower than 1. That means that all of them were acted as a protective factor in preeclampsia. There is no previous meta-analysis for this topic. There is a somewhat similar systematic review done 2 years ago, where they only had a small paragraph about dairy consumption, and they didn't really investigated it that much. So in summary, we have 2 great projects. The first was already submitted during July, and the second one will be submitted during next year. And I would end with a quote from Abraham Lincoln: "The best way to predict your future is to create it." Thank you for your kind attention.
Dávid, congratulations. Actually, this sentence is one of my best. So good to see. Everyone who tried to handle hypertensive disorders in pregnancy, I give a green light, because this is a huge part of the maternal mortality in the modern world, and we cannot handle it properly. Sometimes I feel it also. What do you think? What is the future of this microRNA? A standalone test or a panel analyte, a part of a panel analyte? What do you think?
I would say that it would be a part of the panel analysis. So right now, the most important tool that we have is a ratio between two biomarkers that can show the prognosis of preeclampsia, and we need much more sensitivity and specificity in order to use it in clinical settings daily. So maybe microRNA could add value to this assessment technique, and could be implemented during the time of the diagnosis of preeclampsia or in early pregnancy. It depends from the future research.
Yeah, we can read many useful papers from the team of Sándor Valent, so I'm happy to see you here.